The Leap Foundation proudly presents the Meet the Mentor podcast with Dr. Bill Dorfman. Dr. Bill is a TV host, New York Times best-selling author, two-time Guinness World Book record holder, fitness guru, celebrity cosmetic dentist, and philanthropist who founded the Leap Foundation. Here's Dr. Bill.
Hey, Dr. Bill here. So we're getting ready to do another exciting Meet the Mentor with a man that I met at Leap this year. But before we do, let me tell you a little bit about Leap. If you don't know about Leap, Leap is a motivational leadership program that we do every summer at UCLA, except when there's a pandemic, then we do it virtually. And we've done 16 or 15. This year is going to be our 16th. The dates will be July 16th to the 22nd. Students live in the dorm. We'll have probably about 450 students attending Leap, and it is a phenomenal experience. We bring in the best motivational leadership speakers on the circuit. There's a man named Jonathan Sprinkles who speaks every year. He's a total home run. And then we get all these amazing celebrities. In the past, I've had Mark Wahlberg, Paula Abdul, Michael Strahan, Hannah Brown from The Bachelor, Kathy Bates, Anthony Hopkins, Jason Alexander, on and on and on, Eva Longoria. And it is a phenomenal program. So if you don't know about Leap, check us out. The Leap website is www.leapfoundation.com. And the reason we started doing these Meet the Mentor podcasts is because we had so much amazing content and so many amazing people giving information to students. We thought, let's share it with the world. Well, it took off. We are in the top 2.5 percentile of all podcasts worldwide. We're ranked in the top 100 podcasts in over 100 countries. So it has really grown and kind of, gotten a life of its own. So without further ado, I want to introduce you to my friend, Mick Emandi. Mick has been in the healthcare industry for over 30 years. He's owned and managed hospitals, imaging centers, pharmacies, and laboratories. He's also worked in multi-specialty doctor's offices throughout Florida. He currently has over 40 clinic locations across Florida and a national telemedicine company for mental health and pain management. More recently, he's launched a revolutionary patent-pending all-natural supplement alternative to prescription ADHD drugs for instant focus, energy, and motivation. It's called ClariGenZ Focus Plus to help everyone become more productive in half the time and improve mental health performance in school and in work. ClariGenZ is also a sponsor of the Leap Foundation. Mick is married with 2 daughters, age 16 and 19, who will attend Leap next year and resides in Miami, Florida. Mick, welcome to Meet the Mentor.
Thank you, Dr. Bill. Pleasure to be here. Pleasure to be at Leap. It was really amazing. I was like, this is just like Tony Robbins.
Yeah, except for students. Do me a favor, and just for a second, before we get into Mick, tell parents why they should send their kids to Leap.
I was very inspired by Leap when I heard about it, actually. When I was younger, I was chosen by my high school to be the representative for a seminar called Seminar for Tomorrow's Leaders. And it was very similar to Leap, except you have all the celebrities, you have all the energy and the motivation going on throughout the week, and it was just amazing. So, as far as what Leap does, what I found that it really does help is give young people direction. It gives them insights. It gives them perspectives that they really wouldn't get from going to school every day. And it gives them real world understanding of how the world works, and it gives them exposure to people that are doing it right now, doing what they want to do, doing things that they can only dream of maybe be doing in the future. And a lot of people were inspired just by your career alone. But so many great mentors showed up, and throughout the week, I sat in on much of the content that you put out, and all the sessions and speakers that you had. It was just amazing. So it's my kids are going to go next year for sure.
Well, thank you. So you've been in, healthcare for 30 years, and then you come up with this idea for ClariGenZ. How did you make that transition? And what inspired you to create this?
So, we in our practice currently use a lot of alternative healthcare solutions to get patients away from prescription drugs and their dependence on them, and also the side effects associated with those prescription drugs. And my father's a world-renowned cancer specialist, and he's our founder actually. But he and I were really looking for a better alternative to the SSRIs and benzodiazepines that our patients were taking. And we found out about a certain ingredient that really has not been utilized in the world, really. And we were able to get our hands on some of it, and we were able to test it on some of our patients for anxiety. Providing an all-natural alternative for them to be able to get rid of their anxiety. So this particular compound is made from the skin of oranges. So it's 100% natural, and it does not have any side effects. It's not a central nervous system stimulant like amphetamines, like Adderall and Vyvanse or caffeine even. So we were able to try it on a few dozen patients. We got amazing results, and then we got amazing results for people with anxiety, and we found that at a higher dosing it worked just like Adderall. I mean, it kicked in within 30 minutes. It gave them immediate focus and motivation and energy, and we ended up going forward with a study of about 800 of our patients.
So let me ask you this: how do you just do that? Like, aren't there regulations with like the FDA and this and that? And who actually conducted these studies? Because I know that if you want to conduct and publish a study, obviously it has to be unbiased. You need to get like a third party involved. So maybe you can kind of start at the beginning and give us a little bit of a roadmap. Like, let's say tomorrow I discovered some amazing natural, bee pollen that, makes your hair never fall out. Like, what would I do next? Like, where did you go, and how did you start the process of really honing in on what this extract from the skin of oranges does? What was the first step?
So the first step, like I said, was to test it out on a few dozen patients, because we've had really great.
But how do you do that? I mean, is that legal? Like, you can't use.
Yeah. I was going to get to that. So in the United States, all supplements are exempt from FDA testing requirements.
Okay.
So that's the first thing. So obviously, if you put out a product, you have to be able to stand by it. It's not supposed to hurt people or give them any kind of negative.
But there's no regulatory board or anything. You can just take whatever you want and say, okay, people, try this.
For all intents and purposes, yes. So
wow, that's crazy.
So this particular compound was used a decade ago, but because it costs more than $53,000 for a single pound to make, nobody really found it commercially viable. And so, when something is able to provide a certain level of
efficacy,
results, efficacy and results, then you find a way to make it work with whatever patient population or customer base you're looking to be able to cater to. And
okay, so wait, let's do a quick recap. So you discovered something that had been used before,
for something else.
And it was a little cost prohibitive. So you guys went and kind of looked. So what made you think that this could be something that could possibly replace other drugs for ADHD?
Now because this is on video, we don't want to say that we're replacing any drugs. We want to be able to say that it provides a lot of the benefits of other drugs,
Okay.
like Adderall. And so from that perspective, we initially thought it would be a great alternative for our patients with anxiety. We have a lot of patients with PTSD, ADHD, anxiety, depression.
But what made you think this particular compound would be effective for that?
We tried several. So this particular compound showed the highest efficacy.
But what made you pick this one? Like, you could try 20 million different things. Like, what the research made you feel like, okay, this could maybe be a fit?
Well, because the research had shown that this has the highest level of efficacy, but the only reason it wasn't being used is because of the cost.
Got it.
So,
okay, fair enough.
Cost is, if you have money, you can kind of do anything, right? So,
and you figured out a way to make it less expensively?
Yeah, well, in a manner of speaking, yes. Currently, initially we were selling it at 3 times what we're selling it right now, because we thought, we're going to make a profit, and that's what we need to do as a business. And right now we're selling it pretty much at cost to be able to build a large base. Once we get to a few million capsules a month in sales, then we can bring down the ingredient cost by buying in bulk.
Got it.
So we want to basically make sure that there's a market for it, and make sure that a lot of people love it and that want to use it. And in doing so, we feel confident that in the long run, over the next several months, we'll be able to bring that cost down by around 50%. And
so currently, what's your distribution channel?
It's strictly online. And we, because it's a supplement, it's something new. We actually offer it as a free trial, where we provide 2 capsules for anybody to try. It's basically free 2 capsules and free shipping, and so they can try it. If it works for them, they're welcome to come back to the website and buy whatever they'd like.
How did you come up with the name ClariGenZ Focus Plus?
So, first of all, what this particular product does is it provides clarity, focus, and motivation, right? So out of those 3 words, clarity, we basically try to match up words. And then we were, because we were dealing with a lot of ADHD patients, and a lot of them were younger, more or less in the Generation Z, even though it is very applicable for everybody at all ages. So that's Generation Z, or Gen Z, right? So we kind of just put the 2 words together. That's ClariGenZ.
So tell me what the action plan is for the company now.
So we are right now, currently, we just started working with influencers. We have influencers with a few million followers each coming online as ambassadors, and we're going to be using social media. I sponsored a football team last summer, or actually 6 months ago, and they all loved it. They all talked about how it really helped them with their game, helped them focus better, perform better, get more touchdowns, more sacks, all of that, more catches and things of that nature, by enabling them to really focus on the game and avoid clear out all the distractions, and give them the drive and motivation to stay focused on what needs to be done during the game. We're now really making a big push in the golf arena, because golf is a very mental game, as you probably know. And it's also the most affluent, widely recognized sports. So we feel that our target population for the golf would be over 40 people that are having challenges with mental clarity, focus, being distracted all the time, and being able to have the drive to really get on the greens and focus on getting the best score possible.
And what's your big goal for this company?
So we're a sponsor of Leap, of course, and one of the things that we want to be able to do is get celebrities and people in the athletic arena, people who young people are very impressionable with, to be able to encourage them to stop taking Adderall for being able to take advantage of, to get good grades and ace their exams. About 30% of all college kids take Adderall, and it really disrupts their whole sleep cycles. It leads to abnormal heart rate, and it degrades certain organs in the body also.
All right.
So we're trying to get them. A lot of people who don't have ADHD take Adderall because it's considered a study drug in college.
And what's next for Mick after you get ClariGenZ up and going and becoming as ultimately successful as you've been with everything else? What's next on your agenda?
Well, we're going to be utilizing our telehealth platform to be able to utilize ClariGenZ as a treatment modality, as part of our treatment protocol for mental health patients with anxiety and ADHD all across the United States. So it's actually going to be incorporated into our treatment protocol. And we're using genetic testing and results as part of that assessment of our patients. So it's something new that we're launching that has not been done before in the United States.
That's awesome.
Yeah.
That's awesome. If students wanted to contact you directly, what's the best way to do that?
Yeah, they can hit me up, Mick, M-I-C-K, M as in Mary, I-C-K, at ClariGenZ.com, ClariGenZ.com.
Cool. All right. We'll put that in the notes. Mick, thank you so much. Thank you for coming to Leap. It was such a pleasure meeting you. And I really look forward to meeting your kids, your 16 and 19-year-old at Leap next year.
Absolutely. Love to see you next year too.
All right. Hey, Dr. Bill, over and out.
To learn more about the Leap Foundation, go to leapfoundation.com or find us on Facebook at facebook.com/Leap Foundation or on Instagram at Leap Foundation. Listen to the Meet the Mentor podcast with Dr. Bill Dorfman on Apple Podcasts, Google Podcasts, Spotify, Stitcher, or wherever you listen to your favorite podcast.